It's a great privilege for me to welcome you to the National Optical Conference.
It's been fantastic. Yet again, we've had another record-breaking year. So many people are just working so hard locally, but I think just bringing them together, getting them engaged in wider topics, it's just been so positive. It's great.
We've really had a lot of discussion at the parallel sessions and a lot of interaction. That's made it a really useful event.
I think it's been fantastic. It's been a great opportunity for networking, but also to really come together and see some of the great progress over the last 12 months, and in particular around the big consultation that's been going on with the NHS around the call to action.
So we very much intended for the call to action that we would really open a debate about the future of eye health services in England.
I think we were all very impressed by Taryn from NHS England. She set out for us the key themes of the findings of the call to action. We're now waiting to hear what that means in real terms, but I think we're delighted to say that they've been listening.
I'm sure many of you have found the last few years in the NHS quite frustrating, as we've come through a time of change.
For me, the greatest standout was the call to action section yesterday, and to see the great synergies between general practice, pharmacy, dentistry and eye health.
It was very interesting to hear what the dentists had to say as well, and just to get a view of what the other primary care professions are, the challenges they're facing. It's nice to realise that we're not perhaps on our own as much as we think sometimes. We think we have a unique set of problems, and clearly we don't. They're shared amongst other professions as well.
We've got a lot out of this, but one of the things we got out of this was actually not fundamentally asking for permission. We've got over a bit of a hurdle in saying we'll wait for what the answer is. Here was a direct request to say, you tell us what the answer is. And that has led us into being a little bit more, I'm going to say it, aggressive about what we believe in, about what we want to do next.
We've worked quite hard in optics and eye health to get together and speak as one voice in recent years. But I think now we're getting the message that with our colleagues in pharmacy and general practice and dentistry, our messages to the NHS and NHS England in particular can be a lot stronger. So I think at a local level, they're already doing that in some respects, but I think we just need to step that up a gear locally and nationally, and really hold NHS England to account for implementing the good stuff that they've heard from the call to action.
I'm really hoping for a great role of community optometry in the provision of healthcare in the NHS, and I think that's a great sense of progression for optometrists.
Collaborative working is going to be the way to go forward, bringing secondary care and primary care much more together, but also that we've got a very underutilised skill set within optometry, that there's a lot of skills and a lot of equipment in practice that is woefully underused at the moment and could do a lot more to help both the health economy and patients.